Hello, my name is Claire Kittner. I am a physician assistant in the Dumoulis Center for Cardiac Arrhythmias at Massachusetts General Hospital. You have been referred to the Cardiac Arrhythmia Service because your doctors believe you might have an abnormal heart rhythm that requires monitoring. These abnormal heart rhythms include very slow or very fast heart rates, irregular heart rates, or problems with the natural wiring in our hearts that prevent the top and bottom chambers of the heart from talking to each other. An implantable loop recorder is a small device that watches and records what your heart is doing. This device can stay in place for as long as your doctor or provider thinks you need to have it, but the battery will last for over 3 years. After 3 years, the device can then either be removed or exchanged for a new device. For this procedure, you will be able to go home the same day. At the start of the procedure, an area on your upper chest will be prepped and cleaned, and you will then be covered with a sterile drape to keep the area clean. Your doctor will give you numbing medicine to an area on your upper chest and then will make a small incision here to place the device. The small incision site will first be closed with a layer of absorbable sutures that are under the skin. These will dissolve over time and will be absorbed by your body. We don't do anything with these. On the incision itself, there are those white pieces of tape called steri strips. On top of that is a piece of gauze and a big piece of tape. The tape and gauze dressing will stay in place for 5 days after your device is placed. This may not get wet, so you must either sponge bathe, or if you have a handheld shower head, you can shower if you keep the shower head below your waist. You should not take a shower normally for these first 5 days. If the dressing gets wet and falls off early, this increases your risk of infection. After 5 days, you can remove the tape and the gauze dressing. The steri strips will be underneath, and you can get these wet in the shower normally. The steri strips will fall off on their own in a week or 2. The incision can get wet 5 days after your procedure, but we do not want it submerged in water for 1 month. This means no swimming, baths, hot tubs, lakes, oceans, or pools. On the rare occasion, a surgical glue may be used to close your incision, which will not be covered with a dressing. You will receive specific instructions regarding your type of dressing and when the site may get wet before you are discharged home. There are no restrictions with movement or activity with the implantable loop recorder. It is normal to have some discomfort at the incision site for a few days after the procedure, and we recommend Tylenol for the pain. We will also review your medications and when it is safe to resume these. If at any point in the next few days, weeks, months, or years, you see any bleeding or pus at your incision site, any swelling, or if you have a fever, chills, or night sweats, none of these things are normal. You should call the office or the device clinic and let us know. We would rather you call us every day if you are worried about something rather than waiting to see if it gets worse. You can also send a picture through Patient Gateway. After your device is placed, it will be paired with a monitoring device. This may be a phone app or a monitor you will keep next to your bed. Your monitoring system will download information from the loop recorder every night, save them, and if everything is stable, it will send us a report every 45 days. If the monitor notes an abnormal rate or abnormal heart rhythm, it will send us a report sooner. We will call you if we see something that needs to be addressed. No news is good news in terms of your remote transmissions. You also have the ability to send in a remote transmission to our clinic at any time should you experience any unusual symptoms at home. This includes chest pain, palpitations, shortness of breath, dizziness, or lightheadedness. We would also like you to call us if you choose to send in a remote transmission so our device clinic can review it sooner rather than later to determine if anything appears to be abnormal. With regard to follow-up, your provider will let you know if you need to come in if your device alerts with anything abnormal. If you are having any symptoms in the meantime, please call the office. If you have any general questions, you may call the office at 617-724-4500 between the hours of 8:30 a.m. and 4 p.m., or you can send a message through Patient Gateway. Please note, we do not check Gateway messages overnight or on weekends.